Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back, everyone. Here we are, another episode. We are just plugging along, and I'm so thankful that you are here. And today we are talking about why might your hair be falling out. This seems to be a common theme in the office lately and has been for several months now, and it's likely due to probably some stress of the last year and this year, etc. Also, it'll be maybe due to some other reasons that we'll talk about, but it is very common. But first, before we talk about what's abnormal, let's talk about what is normal. So normal hair shedding is normal. Like, you should shed your hair daily. Like, on average, we shed about 50 to 100 hairs per day. Like, that is normal. I would say the average in that is about 80 strands of hair. So that's a lot of hair. But for us women, like, we typically have longer hair, and I don't know about you, but I have a ton of hair. So it's constantly falling out, and we should lose about 80 strands of hair per day. If it is coming out in clumps, which I have seen, I have had patients bring in their hair in little envelopes. I've had patients show me pictures of hair. I've had you name it. I've seen it all as far as the hair loss goes. And if you have clumps of hair coming out at a time, like, this is not normal. So that's where we have to figure out what's normal, what's not normal. But typically, losing hair is normal. So like I mentioned, if it's anything outside of that, then that's where we have to dig a little bit deeper and figure out what it is. Also, too, if you're experiencing hair loss, it might not be something that's immediately affected. Like, the trigger likely happened 3 months prior, if not a little bit longer. So think back, like, if all of a sudden your hair starts falling out, like, think about what happened. Like, did something happen within the last 3 months? So for me, it was around COVID times, and when we were at our stay-at-home order, and then I started noticing, like, oh my gosh, my hair is, like, a lot of it's falling out. It ended up being my thyroid wasn't well managed, and I had the Hashimoto's diagnosis. So that was something that happened to me, but the trigger wasn't immediate. It was 3 months prior to my actual noticing of, like, a lot more normal hair coming out. Now, postpartum hair loss is a different story. Like, you should have that postpartum hair loss. However, it should only continue for several months, not a lot of the year, if not more than a year. That's abnormal. So only for a few months should you have that postpartum hair loss. So that's another normal hair loss. But there actually is a medical term for excessive hair loss, and it's called telogen effluvium, which is some strange Latin word that we will not talk more about, but that is, we'll just say excessive hair loss, but there is a medical term, the telogen effluvium, if you want to be technical for it. So today we'll talk about 3 different reasons or causes that might be contributing to your hair loss. And the first one is hormones. I think everything can go back to possibly a hormone imbalance, because when we say hormones, again, it's that big umbrella. We have the thyroid, we have our adrenals, and we have our sex hormones. So it very well could be a hormone imbalance that likely was caused by stress. And who doesn't have any stress? I think we talk about stress in almost every single podcast episode, because stress likely is the culprit to a lot of medical conditions. So like I mentioned earlier, 2020 was very, very stressful for a lot of people. There's been a lot of illnesses. There's been a lot of deaths. There's been a lot of trauma. There's been a lot of change. There's been a lot of abnormalities that have gone on in our world, and a lot of inconsistencies. There's a lot of unknowns and things like that can contribute to stress. So I've seen a lot of post-stress triggers and hair loss from what we've experienced from 2020 and even continuing into 2021. So that's where we would look at the hormones first. Is your thyroid balanced? Are your adrenals balanced? Your cortisol, what does that look like? And then also, is your sex hormones balanced? So your sex hormones might not be triggered by stress. I mean, stress is a big culprit, and I mean, I guarantee you, almost every single person out there has stress to some degree, but could it be due to a hormone condition like polycystic ovarian syndrome or PCOS? In this condition, it's very common to lose hair. It might be due to androgenic alopecia, which means hair loss due to high androgens like testosterone, which is very common to see in polycystic ovarian syndrome. So that's where looking at the well-rounded whole body approach is so important to see where this hair loss is exactly coming from or what is the trigger. Because again, just losing your hair out of nowhere in clumps is not normal. The second one might be malabsorption, or what's known as leaky gut or increased intestinal permeability. There's a lot of ways that we can use this term, but it's an unhealthy gut. So if you have malabsorption or leaky gut, you're not absorbing things. So if you're not absorbing your nutrients, you're not feeding your body the vitamins and the fuel that it needs to grow. So therefore, what's going to happen? Your hair is going to fall out. Think about a plant. If you don't water it or give it fluid or give it sun, that's their food primarily, the leaves are going to fall out. The flowers are going to die, etc. Think of that going on in our body. If we don't give it the essential nutrients, things are going to fall out. We're going to feel fatigued, or, the hair is going to fall out in this instance. So that's a huge one, is all look straight in the gut. I'm like, what's going on with our gut? Do we have a healthy gut? That I talk about gut in almost every single podcast episode too. So that's where 80% of our immune system is. We make our hormone in our gut. So if our gut is not healthy, we are going to have multiple health conditions. So we have to start there. The third common reason that I see of hair falling out is a crash diet. So there are a lot of, I want to lose 20-pound diets super, super quickly, or I'm going to completely eat in a caloric deficit for a certain amount of time so that I can lose weight. And that's great and dandy, like you're going to lose weight, but that's not healthy. Like you're not giving your body, again, the essential nutrients. It's not going to grow. So I have seen a lot of post-stress trigger from a low caloric diet or low caloric intake cause hair loss. Yeah, you might lose the weight, but you're going to gain it back because you can't sustain that lifestyle of eating for very long, nor does anyone really want to do that. So once you start or finish your crash diet, then what? Then you just go back to your old ways of eating, and now you're eating more and things will likely start to grow. But again, I want you to take home that it's not something that happened yesterday. It's something that happened a few months prior. So anytime a woman comes into me with a complaint with hair loss, I'm asking all of these questions, trying to pinpoint exactly what might be the culprit. It might be all of these things, because your thyroid could be imbalanced because of this crash diet. You might have malabsorption that's causing you this the reduced nutrient absorption, and therefore it's affecting your thyroid, it's affecting your adrenals. Now your hormones are imbalanced because, like I mentioned, your gut is so important in healing all of these. So what do you do? Well, again, you find a doctor that will run a comprehensive look at your hormones, your thyroid, ask you all of these questions. You can also ask yourself, well, maybe I'm not eating enough. Maybe I am not getting enough nutrients in the diet. The standard American diet is not giving us the essential vitamins that we need on a daily basis. And 9 times out of 10, most of my patients know that if they're not taking their vitamins, they feel different. So stay up on your vitamins. Know that vitamins are essential. They're not really optional nowadays just because of what we've done to our crops and our soil. And ask yourself those questions like, do I have a lot of stress in my life? Do I possibly have a leaky gut? Crash diets, like did I just go off that diet? Did something traumatic happen to me a few months ago? Ask yourself these questions, because if you don't know the answer, that can cause a lot of panic and anxiety over it. It's like, why is my hair falling out? Oh my gosh, like I'm going to lose my hair. I'm going to go bald. Like that causes more stress in the body, which can make the symptoms even worse. So addressing that root cause is key. And that's where finding a functional medicine doctor or a naturopathic doctor can do that. And as always, you can go to naturopathic.org. I'll link it in the show notes to make sure that you know where to go to find a naturopathic doctor in your area. You can go there, click on find a doctor, put in your demographics, and find someone in your location nearby that can help you. And if you're in Gilbert or surrounding areas in Arizona, I would love to help you get to the bottom of this. But more importantly, I just want to bring awareness to the reasons why. Like, again, it's not normal, and there is a reason why you are losing hair. And again, there's other reasons like medications or chemotherapy or things like that you could lose hair, but these are the most common ones that I see in practice. So I wanted to share that with you today because it's a huge concern, a huge complaint that I see in practice, and I feel like it's important to share really what's going on and why you might be losing the hair, because I think we've all experienced that in our lives at some point. And one more thing to add too, because I know I talk a lot about women, but men can have the hair loss too. They can have the male pattern baldness, etc. And that's likely due, again, to hormone imbalance. So we look at their hormones. The male androgen, specifically testosterone, is a huge one with that. And also the conversion of testosterone. But then it goes back to, do we have the healthy foundations? Are we metabolizing our hormones? Do we have the liver support, etc.? So that's something else to look into too. If you're a gentleman listening to this and you're like, oh my gosh, I have all this baldness out of nowhere, like it's likely your hormones too. But also these other things play a role. The stress, the leaky gut, etc. So find a doctor, get some lab work done. I recommend lab work for everyone. And I hope you found some value in this and learned something. I would love to hear your thoughts. Send me a message. Find me on Instagram. Everything will be linked in the show notes below. And I hope you have a wonderful day. We'll see you next week.